Welcome to part 2 of the lecture on head CT trauma. We're going to start with this case. So this case is a patient that had trauma, and the first thing that you can see when you get to this slide is that you completely lose the 6-pointed star basal cisterns. Remember, they had to be dark. Now we cannot see them. If you don't remember about that, I invite you to go back to our CT anatomy lecture, and they look kind of hyperdense, like kind of white. And this patient that have big trauma, you see that the ventricles are completely gone. You don't see them collapsed, and there's no sulci that you can identify in the top of the brain. And you have these regions where that they look hyperdense. So is it blood or is it not blood? And if it was blood, what type of bleeds would be present in the sulci and in the cisterns? So the differential diagnosis is blood that goes into the sulci is definitely subarachnoid hemorrhage. Acute subarachnoid hemorrhage is going to be between the arachnoid and the pia mater, and it will go and creep into the sulci. You can have it because of trauma. Typically that would happen in the convexities, or because of a blister, a little outpouching of the vessels of the arteries of the brain that can just explode, and we call that a bleeding aneurysm. Those ones typically happen at the basal cisterns. But then we can also have things that look like blood that are not blood. And one of them is that you have so much edema that is dark that the pia vessels become dense just because of contrast. That we call that a pseudo subarachnoid hemorrhage. Or infections can also become hyperdense, like meningitis. Sometimes perimesencephalic subarachnoid hemorrhage, which is a hemorrhage that we really don't know why it happens. It happens in the middle of the perimesencephalic cisterns. Any leptomeningeal infection, or if you have contrast, sometimes contrast accumulates in the subarachnoid space. So let's talk about subarachnoid hemorrhage. So it resides in the CSF spaces. You see it in the sulci, creeping into the sulci, or in the cisterns. They can be small or diffuse, and usually a week afterwards, these patients can have vasospasm. And this is a huge complication of subarachnoid hemorrhage. You have to be careful. The patient just doesn't go home. You have to follow them because they can have a vasospasm. We said that they can be traumatic or aneurysmatic. If they're traumatic, they're in the convexities. If they're because of aneurysms, they happen towards the basal cisterns. So this was the patient that we saw first. The patient was not responding. We thought it was subarachnoid hemorrhage, or we were suspecting it. The patient is completely herniated. You see that there's no perimesencephalic cisterns at all. But we did a nuclear medicine study to look at the brain perfusion, and we saw that there was no perfusion of the brain. So basically, this patient did not have any blood going in to perfuse the brain, and this kind of brain death. And this is because of a phenomenon called pseudo subarachnoid hemorrhage, which is this big brain edema that can give you this increased density in the subarachnoid spaces. Now, that was the oddball. I start always with the oddball just to tell you that everything that glitters is not gold. But let's go now to the subarachnoid hemorrhage per se. So these are subarachnoid hemorrhages. This is a patient that has the subarachnoid hemorrhages in different regions of the brain. Let me highlight them for you. You can see that there's a subarachnoid hemorrhage in the perimesencephalic cisterns. There's some subarachnoid hemorrhage here, the Sylvian fissure. And you can see it in different sulci. So this patient has peripheral subarachnoid hemorrhage, peripheral and basal cisterns. This is very likely traumatic. This patient was a young patient after trauma. This is another patient that has subarachnoid hemorrhage in the basal cisterns. We said that if it's in the basal cisterns, you have to suspect aneurysm. But if you look carefully, there was a fracture of the roof of the orbit. So they can also be traumatic. This is a traumatic subarachnoid hemorrhage, and you can see it in the basal cisterns because of a fracture. Or you can have one that is mostly located in the basal cisterns, like here. Remember, the basal cisterns has the six-pointed star shape, but now you see it's so dense white hemorrhage. It's in the basal. You have to suspect an aneurysm. And when you do the 3D reconstructions, you can see that in this vessel, let's leave it there, which is the internal carotid artery, right? There's that little outpoaching, which is an aneurysm, which is the one who bled. And this was an aneurysmatic bleed. But not all the subarachnoid hemorrhages are because of trauma or because of aneurysms. They can also be because of other things like meningitis. You see that you have hyperdensity in the basal cisterns. In a patient that has hydrocephalus, the ventricles are very expanded, right? When you put contrast, and this is an MRI T1 with contrast, all the basal cisterns are just exploding in enhancement. This is a granulomatous process. That's a bacillus meningitis, and this is typical of this case, which is a tuberculosis. They tend to give you these things that look, it can be confused with subarachnoid hemorrhage. This is a case of a young lady that came to the ER. She was 48 years old with this subarachnoid hemorrhage in the perimesencephalic cisterns. We did multiple studies. We see the bleed here, and the angiogram was absolutely normal. So these are these perimesencephalic venous subarachnoid hemorrhages that you have just to be aware of as part of your differential diagnosis. Or this is an infectious one that is happening in the periphery. You see the hyperdensity in the sulci, and here in the flare, T2 flare, and you see how it's creeping through the sulci as well. In this patient that had leptomeningeal infection, as demonstrated in the T1 with contrast, and you see the enhancement in the subarachnoid space. So that's kind of subarachnoid. When you see subarachnoid hemorrhages, the last thing you have to be aware is make sure that that patient didn't have contrast before for another study, let's say for a CT with contrast, because contrast can leak into the subarachnoid space and make you believe that you have a subarachnoid hemorrhage. So this patient didn't have anything. He went the next day. He showed up and he had diffuse subarachnoid densities all over. The resident called immediately to say that he had diffuse subarachnoid hemorrhage. The patient was completely normal. And what he didn't show is that the patient had a CT of the abdomen with contrast. And that contrast had leaked into the subarachnoid space. And sure enough, the next day it completely cleared out. So anything that is hyperdense that is in the subarachnoid space is going to look like that. So with this, we finish part 2 of our CT trauma.